everyone, welcome back. We have another dermatologist reaction video, and sitting with me is board certified dermatologist Dr. Nina Desai.
Hi Susan, I'm so excited to be here.
I'm so excited. You can find her in Manhattan Beach, California if you do want to look her up. Today we have a really fun video because we are looking at a woman named Alisa, and she has some pretty typical anti-aging questions. So we're going to take a look at her routine and maybe even suggest a new routine.
Let's do it.
Hello Susan, my name is Alisa and I am 31 years old, and today I will be showing you my skincare routine. So my skin is more, I would say, normal, on the drier side, especially now when winter is coming. One of the concerns that I have is that I don't have any problems with acne or anything like that. But since I'm 31 years old, I started noticing that I have some fine lines that are appearing on my face, especially around this crow's feet area and on my forehead. This is my main concern, and I hope that you can help me to analyze my skincare routine and see if you can have something better to advise for this particular problem.
All right, so first off, I'm so glad she doesn't have to deal with acne. That's such a nice feeling. I feel like, you know, we're constantly getting people submitting and they're like, I have acne, and we're like, this is gonna be a long road. We have to work with you on that. But she is dealing with something else that is very common, right?
Absolutely. This is probably one of the first questions that I get asked during a cosmetic consultation with a patient is, how do I deal with these fine lines and wrinkles? So we got you.
Yeah, definitely, definitely.
I think whenever we talk about, you know, that anti-aging process, it's a multi-step process. We're going to have our, you know, our preventative treatments that we do in the office. We're going to have some corrective treatments that we do if we have any issues that, you know, are kind of on our skin that really bother us. And then we've got our maintenance with our skincare routine. So having those really good active ingredients that can kind of maintain our skincare is going to be really important for her.
And I'm not saying that people need to get Botox or filler or anything like that. It's just something to consider if those are what you consider your problem areas, right?
Absolutely. And the discussion is always, you know, we talk about it together. Tell me about the things that bother you and tell me about what you are interested in doing. And then we can talk about everything from products to treatments and really make the perfect plan to make her happy with how her skin looks.
So let's get started. So I wear makeup pretty much every single business day because I work in the office environment, and by the end of the day I remove my makeup. So I use this oil makeup remover from L'Occitane. So what I do is I do like 2 squirts of it with my hands. And focus around my eye area to make sure I remove all my mascara. And after that, I use Hydra cleansing gel from L'Occitane. I also use around 2 pumps.
So I think these 2 cleansers are totally fine. I love that she's doing a double cleanse. I will throw out there that she used water with her oil cleanse. So Alisa, the one thing I would say is that you're gonna get better benefits from your oil cleanser when you put it to dry skin and work it into your face, you know, break down all the makeup, all the grime, sunscreen hopefully that you're wearing, and then you rinse it off. And then you go in with your water-based cleanser like the gel one that you're using, but I think obviously these are fine. The ingredients look totally fine with me.
Absolutely. I don't think either of these is an issue for her. She's got no irritation on her skin, she's got no redness, she's not complaining of her skin being extra dry or extra oily. So I love the fact that she's doing this double cleanse. She's starting with that fresh palette, which at night is so important to go to bed with that clean palette so the next products that you put on are gonna really work for your skin.
So when it comes to anti-aging, since that is what she reached out to us for, is there anything that somebody can do when it comes to cleansing?
Things to keep in mind that we are looking for those really good active ingredients that are anti-aging, and she might benefit from maybe using a cleanser that might have an active ingredient in it, since she's clearly not getting irritated by her cleanser that she's using now.
I've seen some people say that cleansers that have active ingredients are pointless. What do you think about that? And I have said, I think dermatologists would say differently, so I'd love to hear it from you.
Yeah, as a dermatologist, we love putting some active ingredients in our cleansers. Some of the best cleansers either have alpha hydroxy or beta hydroxy acids in there, so we love using them.
Yeah, it makes sense, and you get the benefits even short term sometimes is all you need, right?
Absolutely.
Next step is to apply toner. So for that I use Cotton Round and Pixi Glow Tonic. I like about toner when my skin is still wet, and I feel like toner removes the last bits of the makeup. And I like this toner because it has glycolic acid and it's very mild, so my skin is very gentle. That's what I did mention. It's not really super sensitive, but it is gentle because it's very thin. So I think 5% is more than enough for me. So it is exfoliating, but at the same time, pretty gentle.
All right, so this one's interesting. The Pixi Glow Tonic is really popular. People love this. Sometimes I feel like this is their introduction to glycolic acid. This has 5% glycolic acid. It has a lot of other ingredients in it. Some of them are hydrating. There is witch hazel in this, and then there's fragrance in this product. What do you think of those two ingredients as a dermatologist?
Glycolic acid, absolutely love. The witch hazel, you know, it really depends on what your skin type is. For some, it can be very drying to the skin and it can be almost irritating to the skin. So there's really no benefit to using that on your skin if that is the issue. In terms of fragrance, you know, I don't love products that have fragrance in them. That being said, she doesn't seem to be getting irritated by her products. So when I recommend using a fragrance-free product or a gentle product, it usually is for someone who we know, you know, has a little bit of eczema or rosacea or dry skin, someone who may actually get exacerbated by that fragrance. It's really far down along in the list of ingredients, so I'm imagining the amount is quite small. And so if she's not getting irritated by it, I actually don't mind her using this product.
Right. You know, something I'll throw out with the witch hazel, I think a lot of people think that all witch hazel is created the same. And what they're usually worried about is witch hazel that's distilled by alcohol.
Yes.
With alcohol. And then people don't really realize that there can be witch hazel that's distilled, even steam distilled, and so you're not worrying about that as much. I know that's like, well, how can you tell? But I think that's when you reach out to the company and just DM them these days, you know, or send them a quick email and just say like, just checking to see how your witch hazel is made. And I think it's a really straightforward question that you can ask different brands.
Absolutely.
And then, you know, the other thing that I'm starting to notice, and I was thinking about it with her cleansing too, she's not bringing any of this down to her neck. Especially if you're anti-aging, do you think glycolic acid is something that somebody should be bringing down?
All the active ingredients that you can use for anti-aging, you know, you really want to, don't forget the neck. And of course it depends on the percentages and the composition of what you're using, because you don't want to irritate the delicate skin of the neck. But absolutely, with your sunscreen, with your active ingredients, if you can bring them down, the neck is a part of the skin that really does age us. So we may take really great care of our face, but if you look down at the neck, you can really tell if someone's actually been taking care of their skin.
Yeah, I mean, it can age. I mean, I personally, like, my neck is where I'm always like, oh no, this is where I'm starting to see it. And I know that I've taken great care of my neck, just like my face.
Yeah.
But sometimes it can show even faster there, right?
Absolutely.
So the other question I have is, this is a 5% glycolic acid. She's talking about how she has not sensitive skin. She likes to be gentle with her skin though, because she said that it's thin skin. Would you say that 5% glycolic acid is enough for her?
I think this is a great starting point for her. I wouldn't be surprised though if she would slowly be able to increase the percentage of what she's using, especially as we mentioned, she doesn't have irritation on her skin or over drying of her skin. So I'd like to see her try to bump things up a little bit.
Who would be the people that should use a 5% glycolic acid versus like an 8 or a 10%?
So anyone who has sensitive skin, or perhaps those who have skin of color, anyone who's going to be a little bit more susceptible to drying or irritation from a product, I would always start at a lower percentage.
That makes sense. Can people of color, you actually bring something up that I think is very interesting in a topic lately. Can people of color actually use anything higher than a 5% glycolic?
It's all about tolerance. So everyone is different. Those that have darker skin tone, they're going to be a little bit more susceptible to irritation or drying or inflammation that can occur from a new product, so always go slow, but yes, you could work your way up.
Then I apply serum, and I have advanced night repair from Estee Lauder, and like I said, my main concern is fine lines, and this is supposed to be anti-aging serum. So I applied on my forehead, my cheeks, And on my neck area.
So this is an interesting one because I see the Estee Lauder Advanced Night Repair in so many different routines. She wants anti-aging. I have no problem with this product. I actually think it's a very nice serum, especially because it has so many antioxidants in it, but that's what it is it's an antioxidant serum. What do you think about this? Especially if someone's saying that they want anti-aging.
Oh, absolutely. I have no problem with her using this. I think antioxidants are so important to your skincare routine. The hyaluronic acid that's in there is so important to, plumping up the skin. But we could definitely be more aggressive with her skincare routine. She is in her early 30s. She's starting to develop those fine lines, forehead, crow's feet. That's where we start to get them. The fine lines that, we first notice because of the movement of the muscles in those areas, and then they become lines at rest. And when we have those lines at rest, we really have to do more with boosting our body's collagen production.
We'll address this I guess at the end when we're coming up with her skincare routine, but that is something to point out with the Advanced Night Repair. It's a great antioxidant serum. It's very hydrating, it's very soothing, but it is not, I wouldn't call it really an anti-aging serum. What I would think of it as like a strengthening serum.
And in the name, it says it, night repair.
Yeah.
The antioxidants, they're great for repairing the skin. They're great for that free radical damage that's occurred on our skin because of sun and pollution, but we need a little bit more.
Right, you're not getting your actives like the retinoids or even any kind of exfoliator or anything like that.
Right, so she definitely needs something that's gonna boost some more collagen.
And the last step is night cream, antioxidant night detox cream from Estee Lauder. It has pretty mousse-like texture, unlike other night creams that I tried. I don't think I'm a particular fan of this cream, so if you have any recommendations, please let me know.
I actually have not tried this particular moisturizer. We were just looking at the ingredients. It's a really long ingredient list. And just like the Advanced Night Repair, there is some coffee in here, coffee extract in here that does help as far as antioxidants again go, and it even can help kind of constrict
blood vessels, absolutely.
Yeah, so I think it's nice. It's a really rich moisturizer. There's dimethicone, there is shea butter, there's squalane in this. These are all really good moisturizers, right? I wish she would have said what she doesn't like about it if she's not a fan, because it should technically on paper be a very nice moisturizer.
Yeah, I have no problem with her using this as her nighttime moisturizer, but again, we're really looking at what she's trying to accomplish. If she really wants an aggressive anti-aging routine, then I think we need to add a few more ingredients into her nighttime routine.
All right, well, let's see if she adds anything else. I mean, I was hoping for a retinoid.
Yeah, me too.
But let's see.
The last step is to apply something on my lips, and for that I use lanolin from Middle brand because I was recently breastfeeding, so I still have some left over, and it works amazing for lips. Alright, so that was my nighttime routine.
Okay, so we actually just got some insight into something, and that's that she just finished breastfeeding. And I do think this is when it's like the end of the first pregnancy, especially, that's when women start to be like very aware of their skin. Suddenly I feel like I look different. What is it that's causing this? So now a lot is making sense to me.
Absolutely. What we don't realize is during pregnancy and during nursing, our skin changes tremendously. The hormones and the way our skin looks and feels really does change throughout all those fluctuations. And it seems like now she's starting to notice that.
Yeah. When I think back on, especially my first pregnancy, after I was all done and my skin started feeling like it was back to normal and everything, I did notice that. And I don't know if it's that like expansion of gaining all that weight and then losing weight rapidly. You do feel like you are looking a little bit older, right?
Absolutely. Your skin can change in so many ways. It definitely in terms of its hydration, in terms of the laxity, all of that really can be exacerbated by pregnancy.
Yeah, we obviously saw she didn't have any aggressive ingredients in her nighttime skincare routine. It makes a lot of sense because she just finished breastfeeding. I feel like women don't use any real actives, right?
So now is a perfect time for her to start incorporating some of those actives.
Yeah.
She's at this stage where she can bring a vitamin A derivative or retin A into her routine, and I think what that's going to do for her is what she wants. She wants that collagen boost. She wants to start to see some improvement in those fine lines and wrinkles, and that's where she's going to get that.
All right, so we'll put together a full routine, but let's check out what she has in the morning because she also included that.
For my morning routine, when I wake up, I do not use any cleanser. I just rinse my face with water because I'm sure I already cleaned it well enough in the night. I use Mario Badescu toner, and it has witch hazel and rose water. I don't really like this toner because it has very strong odor. It has like scent of rose sort of scent, and I don't think it's good for your skin. So maybe if you have any good recommendation for a morning toner, that would be great.
I think this is kind of typical, right? Like this is what I tend to see a lot, and I completely understand it because I contribute, when I talk about my personal skincare routine, I contribute to this type of, I guess, routine a lot. And I tell people I don't tend to wash my face in the morning. Every once in a while I do, depending on what it was I had on my face at night. Now, after talking to you about mask acne, whenever I'm gonna wear a mask for a long time, I make sure to wash my face in the morning. But then on other days, especially since I have dry skin, what I tend to do is I wake up and then I might just splash some water on my face and then use some type of a hydrating toner. The thing about this one, and she's already acknowledging that she doesn't love it because of the fragrance, it's not very beneficial, right?
Yeah, I don't really see too much benefit to this product in her skincare routine. If she's using this product instead of a gentle cleanser in the morning, I would almost urge her to just use a slightly mild, gentle cleanser in the morning if you feel like there's oil or dirt left behind on your face. But I don't think she's really getting any benefit from this particular toner.
Really, the only beneficial ingredient in here is that there is some glycerin, which is a hydrator. Otherwise, it is another dose of witch hazel, which then starts to become a little bit too much. There is fragrance in here, the rose extract, the rose oil. So there are just those types of ingredients, and really at the end of the day, not necessary.
I don't think it's necessary.
Yeah. What do you think about like the hydrating toners though, if they didn't have like a witch hazel in it or something?
I think it's all about what it's doing for your skin. So the benefits of a hydrating toner, or if you are one that's kind of on the drier side, or if you need that extra hydration in the morning, then that's when you want to use it. So as a dermatologist, you know, a lot of us are, it depends on what's in that toner. And if it's a step that isn't really giving you much benefit, then I would say leave it out.
So then that Pixi toner that she was using at night, could that be something that she bumps to the morning?
She could. I think she would be able to tolerate the 5% glycolic in the morning.
Okay, as long as she's wearing sunscreen, which we will find out.
Absolutely.
So then I apply eye cream. I use hyaluronic eye cream from Mario Badescu. And then I apply tiger grass color correcting treatment as my moisturizer. And this is supposed to be also an SPF. Sort of cream. It has SPF 30 in it, and also it is says it's a great base for your makeup.
There are a couple of things happening. The eye cream, which is totally fine to, I think it's actually great to use an eye cream in the morning. That's when I tend to choose an eye cream because I'm like, okay, I'm gonna wear concealer. I don't want it to sink into my fine lines and wrinkles. Eye cream it is. This one is actually a pretty rich under eye cream, so I actually think it would be more beneficial after her moisturizer. But the moisturizer is where we're a little bit confused, right?
Yeah, so she is someone who might benefit from a hydrating eye cream because if you look, some of her issues with fine lines are really the deepness or the depth of what we call the trough under the eye. And that makes us look a little bit more tired. It makes us look like we have darker circles under the eye. So really hydrating that delicate skin under the eye is going to help with anti-aging.
But when it comes to this moisturizer is more of a calming moisturizer. I believe this one has a little bit of a tint to it that calms that redness too, so you can't see it. It camouflages the redness. And then it also has SPF 30 in it. So I think there might be a couple of things happening in this moisturizer that might not be right for her, right?
Yeah, so I would ask her, do you tend to get red on your skin? Do you tend to flush, or do you tend to have broken capillaries? Things like that. Because this moisturizer is great for that anti-inflammatory component. So just a little curious about if there are some issues going on her skin.
Yeah, because we can't, as of like what we can see, we don't see any redness, right?
I don't know.
Yeah, so instead, I would probably say to her, what, something more hydrating that's gonna feel a little bit more plumping for her skin?
Absolutely, something to bring some moisture back to the skin.
And then when it comes to the SPF 30, I think personally she specifically needs something very strong, right? SPF 50. If she's really concerned with anti-aging, then she really wants to be protected from the sun, right?
Yeah, for her sunscreen, given her complexion, sunscreen is super important. And of course, applying sunscreen in the morning and then reapplying throughout the day. So if this is a sunscreen or a product that she puts on once in the morning and then doesn't reapply throughout the day, I really would urge her to grab a product that would make it easy for her to reapply throughout the day, because that is going to give her another great anti-aging benefit.
And then when it comes to the reapplication, she says that she wears makeup during the week because she goes into work. What do you think about like the powder sunscreen?
Love them. I think the setting powders, the setting sprays, things like that, they're really great for reapplication throughout the day. And that's what I urge all of my patients. Have one in your purse, have one in the car, so that way you're not without it.
So let me know if you have any other recommendations for me. I will be very interested to learn it, and thank you so much for watching. Goodbye.
I love seeing these routines. I love when someone takes us through all of the steps too, so we can really see what they're doing.
Absolutely. I think the biggest issue is that she's missing some key powerhouse ingredients in her skincare routine. And if she wants a great anti-aging routine, we've got to work those in.
Yeah, for sure. So let's hit her nighttime routine first. So when it comes to the cleansers, we thought everything was fine except use the oil cleanser first on dry skin, right?
Yes.
Okay, and then Pixi, do we want to bump that into the morning routine or keep it into the nighttime routine?
I would actually move that to the morning routine, and I'd like her to use something a little stronger at night.
Ooh, what do you mean by that?
I would like her to move on to a retinoid or a retin-A, so she can use her toner in the morning, but at night, because she's never used a vitamin A before, we want it to be the only exfoliating product that she tries at that time. So I wouldn't want to over dry her. I want her to work it in gently and slowly, but I think it's going to give her such good benefit.
Do you think that somebody who has never used a retinoid before, do you think that they should potentially go straight to a prescription, or do you think they should do an over-the-counter?
It really depends. So I have a lot of patients that, you know, their intro into the world of retinoids is a prescription strength, but we work slowly. We start out like 2 times a week at a low percentage, and then we slowly work our way up.
When it comes to introducing a retinoid, this is when it's really, really important, is because she came to us saying that her big issue is anti-aging, right? Like she wants to address her fine lines and wrinkles. I don't think people really realize what retinoids do.
Vitamin A, or a retinoid, is a vitamin A derivative, and what that's going to do for you is it's going to help boost collagen production. So as we age, our body produces less collagen every year. That contributes to fine lines, aging, sagging skin, the elastin in our body, which contributes to, you know, the elasticity
The
and
bounce back.
how tight our skin looks. That also changes, and a retinoid, or a vitamin A derivative, has the ability to trigger new collagen formation. So it really is important in our anti-aging routines.
Could she actually use the advanced night repair after that?
She could. I would just urge her that if she brings on a product like a retin-A, and if she finds that it's a little drying or a little irritating to the skin, don't stop. Just cut back on how much she's using, or alternate it with her advanced night repair. So one night she could use her retinol, and one night she could use her advanced night repair. It's all about tolerance.
As far as the moisturizer that she uses, I mean, I think on paper, without touching it and knowing what it feels like, I think it would be a great moisturizer for her. What do you think?
I do agree. I think that I have no issues with her using that moisturizer, and I think the fact that it's a little bit more hydrating to the skin and she's not having any issues with it is going to make that transition to adding a retinoid a lot easier.
Yeah, and she could probably, if the retinoid is too strong, she could probably buffer it first, right, with that moisturizer?
Yes, she could. You could always, in a way to make your retinoid less aggressive or less, you know, irritating to the skin, you could apply your moisturizer first.
All right, so then let's look at her morning routine.
So I would actually remove the toner in the morning.
The Mario Badescu one.
Yes, I think it's an unnecessary step that's not really adding too much benefit back to her skin. Again, if she is feeling like there is a little bit of oil buildup or a little bit of dirt on her face when she wakes up in the morning, I'd rather her use a very mild, gentle cleanser. And if she doesn't, then she really doesn't need the cleanser or the toner in the morning.
Okay, that makes sense. And then we do think that she could pop in that Pixi Glow Tonic or even something stronger.
Yes, I do think that that would be a great place to kind of move her Pixi Glow Tonic. I love glycolic acid. I think it's wonderful in starting that exfoliating process. I think the alpha hydroxy acid component is wonderful to use on your skin. especially for anti-aging purposes, I wouldn't love for her to use both her glycolic and her retin-A or retinol at the same time to start out with.
In one routine.
In one either PM routine, so that's why I think the AM would be a great place for her to kind of shift that product to.
And I think a lot of people don't realize when they hear that retinoids exfoliate the skin, it's in a different process, right? I've heard from a lot of people that you want to bring in then your AHAs to really help whisk away all of that skin cell turnover.
Yes, they do work differently and they work in combination with each other. The other powerhouse ingredient that she's missing in her morning routine is a vitamin C. So vitamin C, we all know, really helps reverse free radical damage. So the sun, pollution, anything that can kind of damage our skin, leading to that premature aging, fine lines, wrinkles, pigmentation. Vitamin C is great in protecting our skin from that, so she definitely needs one in her AM routine.
Right, and it also boosts the effects of your sunscreen.
Absolutely.
When it comes to the other two products, right, her moisturizing products, there was nothing wrong with the Dr. Jart one, right? It seems like it's made for somebody else, but maybe she has redness that we can't see. The thing that gets me is that she uses this really rich eye cream before, and I get why she does it. It's because the Dr. Jart is her SPF, so she doesn't want to put anything on top of her SPF, but that tells me that maybe she needs to separate some of her products, right?
I think that if she is really consistent with her sunscreen, she's gonna be a lot happier.
Yeah, so she would basically just separate everything out. Use a simple moisturizer, put on this eye cream afterwards, and not worry about the sunscreen being in her moisturizer, and then use a sunscreen that she can also just reapply throughout the day.
Yes, that's the biggest key for her, is making sure she has a product that she loves how it feels on her skin. She feels really comfortable using it all over, and she's gonna reapply that sunscreen.
Yep, I like that. So pretty simple. It's just all about adding in some of these actives, making sure that she keeps her skin soothed and hydrated. I wonder if she would benefit from going to see a dermatologist also to get a little bit more aggressive. 30-31 was when I started to really become besties with my derms and be like, okay, so what are we doing here?
This is where we start that conversation. So we start the conversation about what do we want to do and how aggressive do we want to be about our anti-aging process. So there are some treatments in the office that we can do to really, get that collagen stimulated, fill in those fine lines, really kind of preserve the skin. So there are lots of options for her, and I would urge her at this point to see her dermatologist.
All right, well, that was Alisa and her anti-aging skincare routine. If you guys want to find Dr. Desai, I will leave all of her information below in the description box. Is there anything else you want to add?
Thank you so much for having me, Susan.
Thank you so much. We will talk to you guys soon.
Bye.
Bye.